Hi, everyone, and welcome to another episode of Sterling Live. My name is Caitlin Brower. I am Sterling's social media manager. This is just a reminder that every Tuesday at 1 p.m. Eastern, we do go live across LinkedIn, Facebook, and YouTube. So please join us every Tuesday. I'm so happy to be joined today by Angela Preston, our Senior Vice President and Counsel of Corporate Ethics and Compliance at Sterling. And today we're going to be discussing the EEOC's role and guidance for COVID-19 health testing. So Angela, please introduce yourself and, say a couple of words about what you do for Sterling and just about yourself.
Sure. Hi, Caitlin. Thanks for inviting me. As mentioned, I'm Sterling Senior Vice President and Counsel for Corporate Ethics and Compliance. I've been here at Sterling going on 5 years. I've been in the industry for about 20 years now, really focusing my career on background screening compliance and the various employment-related laws that go along with that, including EEO compliance, following the EEOC, and as well as the other regulators that are in our space. So excited to share today a little bit of insight about the EEOC's recent guidance on COVID-19 testing and the different EEO laws surrounding what employers need to take into account when looking at returning to work.
That's great. Thank you so much for introducing yourself, and let's go ahead and get into it. But before we dive deep into our topic for today, I do want to let everyone know we will be taking questions throughout the live show today. So if you do have any questions across Facebook, LinkedIn, or YouTube, feel free to go ahead and comment, and I'll field them in as we present today. But let's go ahead and get started. So let's look at an overview of things. So talking about the EEOC's role, what is the role of the EEOC?
Sure. Just to take a step back, for those of you who might not be as familiar, the EEOC exists in order to prevent discrimination in the workplace. Mm-hmm. So as an entity, they are there to enforce anti-discrimination laws, in order to ensure that the public and consumers and workers are free from discrimination. So they enforce a number of laws, primarily Title VII of the Civil Rights Act, and a number of laws that have been passed since then targeting specific areas of discrimination, things like the Americans with Disability Act, the age discrimination laws, mm-hmm. Anything having to do with, an employee's protection due to a protected class or interpretations of that law ever since Title VII.
Thank you. So as we are all, navigating through, this current pandemic, what we're all facing, what is the general guidance that's given by the EEOC during a pandemic?
Sure. So, the EEOC has long published guidance on how to handle issues of discrimination in the workplace during a pandemic. They have recently updated that guidance in the wake of COVID-19. So the longstanding guidance has been the Pandemic Preparedness in the Workplace and Americans with Disability Act. And that guidance was actually updated by the EEOC in March of this year, once the pandemic was named a global pandemic by the CDC. There is more specific guidance that was then updated and posted since then, most recently in June of this year. What you should know about COVID-19 and the Americans with Disability Act, because there were so many questions coming from the employment community and needing to know specifically what do we need to know in the wake of COVID-19. Yeah. So that more recent guidance was just updated in June of this year. And the caveat, I think, with all of this guidance is that as we learn more about the disease, the guidance is evolving. So it's really important for employers and the community to stay apprised of the most recent decisions coming out and the dialogue and any information that we're getting from both the CDC and the EEOC about how to handle different situations, because the more we learn about the disease, the more it will, it could shape the guidance.
Yeah, so I think that's a great point. So interested to get your opinion on how often do you think they're going to update this guidance? Is it just as we learn more about the virus, or are there any other, areas that are come into play here?
Yeah, we don't really have the EEOC doesn't really tell us when they're going to update the guidance, but they have said, that they will follow the cue of the CDC, and as we know, as the science tells us more, the guidance may be updated. So, but right now the guidance has focused on things like medical exams and testing, and very specific questions that employers have with, how do we handle reasonable accommodation issues with the ADA, pre-employment and pre-hire, what are we allowed to do, what aren't we allowed to do, and how do we handle specific things like age discrimination if we have a worker who is in a high-risk category, what do we do with that information? So the guidance, I won't recite it to you, and hopefully we can talk today about just some examples or some questions that we're hearing in the community, but that guidance does address some of those specific nuances. So I strongly encourage everyone who is interested, or this is part of your area of responsibility, to go to the EEOC website where the guidance is published and you can read the specific guidance. We also have some tools that we'll talk about at the end.
Great. So you did briefly mention medical testing. So whether it's for pre-screening or returning to work, how can medical testing be used?
Right. So that is a great question. It's a fundamental issue that employers have to sort of wrap their heads around as they're contemplating return to work, or if you're providing an essential service, keeping your employees at work. What are you allowed to do under the different, and still stay within the boundaries of the anti-discrimination laws? Well, the EEOC has said that because COVID-19 does pose a direct threat to the workplace, and it is it's an active virus, there's no cure, there's no vaccine, that simply having the disease or even having symptoms of the disease could pose a direct threat to your place of work, that employers are allowed to test. They are allowed to do other types of medical screening that you might not typically think of in terms of a test, but employers may do things like do temperature checks.
Right.
They can interview employees and ask questions about whether or not an employee has been exposed to the virus through contact with another person who is known to have the virus. They can do questionnaires. They can, ask about symptoms. And there are published symptoms. You can't ask about things that aren't on the symptom list.
Right.
So if someone's just not performing, or maybe seems a little withdrawn, that's not a symptom of the disease that would pose a direct threat. So you have to kind of stay within the boundaries of what have been identified as symptoms. But all of those things an employer can do and ask about in the context of determining whether or not an employee can enter the workplace. And then taking that to the next logical step, I know that's probably the next question, what do you do with that information?
Right.
Well, the EEOC has said that employers can exclude those from the workplace who do exhibit symptoms or who have tested positive. So that is permitted within the context of, as long as you're not violating any other anti-discrimination laws. But as general guidance, because of the direct threat interpretation, you are allowed to use the information from a test if someone tests positive to say, you know what, you're not safe to come to the workplace right now. Sorry about that. I don't know if you're picking up the background noise.
Okay.
Here in New York City, and the city's day is going on behind me. So So, as I was saying, because a person who does test positive is potentially a direct threat, an employer can act on that.
That makes sense. So you brought up specific types of testing, temperature taking, you brought up questionnaires. What's the case for antibody tests? So I know that is a very popular question, popular topic right now, and there's a lot going about it, but looking at it from like a compliance standpoint, what is the case for them?
Yeah, so antibody testing, I think a lot of people were excited about antibody tests at the beginning, thinking that if you had the antibodies, it would be like a golden ticket, and everybody wants to see if they have antibodies. But what we know now, and again, this is where we've learned more about the disease, and the science has told us that testing positive for an antibody doesn't necessarily confer immunity.
Right.
And the CDC has said that because of that, that employers cannot or should not rely on antibody testing as a determining factor for access to the workplace. And the EEOC has sort of picked up on what the CDC has said in that regard, and has mirrored that in their guidance. So the EEOC guidance also reflects the fact that, simply because you have the antibody present in your system doesn't mean that you're necessarily safe to come back to work. So the guidance is simply that you can't rely on an antibody test to determine who has access to the workplace at this time, because it's just simply not the science isn't there yet. And to treat someone sort of differently and say, okay, these people with antibodies can access the workplace is, that could be discriminatory in itself.
Right.
So yeah,
definitely important for those listening to take that into account for sure. So a lot of what we're talking about, is in regard to returning to the workplace. I do want to talk about pre-hire screening and how this all rolls up into one. But before I ask my question, we did get a question on LinkedIn, and I think it's a more of a generic question in regard to the job market, jobs, and hiring. But I want to see if you can take it and kind of put like a compliance spin on it and see, if we can definitely answer this one here. So how do you see the market or jobs in the next coming months? So, asking, what do you think the job market looks like, hiring, things like that?
Yeah. I wish I had a crystal ball that was I could rely on.
We all could.
I think that, to the extent that our industry sort of sees, we have some insight into where the hiring's happening, and definitely a demand for these essential workers. And, we've seen a lot of screening continue to happen in the world of the gig economy, and certainly essential healthcare workers and staffing, where things are really picking up. And other than that, it's really anyone's guess with, where the job market's going. I will say that, if you're in a position where you're looking at like returning to the office or to the workplace, you really need to start thinking about a strategy and a plan around that, to how you either want to bring workers back. One thing I'll mention is that the EEOC has made it clear that, with in some of their question and answer sessions on this topic, that you can test and you can do temperature taking and all these things in the context of returning employees to a place of work because of the direct threat that the virus poses. You can't implement I won't say you can't, but there could be issues in implementing that kind of testing or screening for teleworkers, because they're not posing a threat to the workplace in terms of just, people who are working from home and that sort of thing. So you need to think about it in the context of what's permissible when you're putting your program together.
Yeah, so we did get another question in, and it's more so along the lines of, partnering with a company and, spending a lot of money on these COVID-19 testings, as companies either return to the office or, we'll get into pre-screening in a little bit. So they could be done at, a cheaper rate from like a medical institution, but working with a company, partnering with a company that offers like an end-to-end solution, how is this useful for employees and candidates, if you have any insight on that?
Sure. So I think that it really is fact specific, and it really does depend on your specific needs as an organization. The test options are growing by the day. So,
yes.
It seems like there are more and more options coming to market and becoming available. So if you've looked at this and said, this price point is not something that we can actually, like my organization can do, I would say continue to keep checking back with your providers, with your vendors and with your partners in this space, because it's so rapidly evolving and there are new options coming to market all the time. So yeah, some of the early options that we have seen, and again, everything has to be FDA approved. Everything has to be, a proven testing method that's reliable. So, but more and more is getting approved every day. So it is a little bit of a moving target, and you should be in close contact with your partners, with your vendors, to keep tabs on what's happening. It's evolving so quickly.
Absolutely. So getting into pre-hire testing, pre-hire screening. So does the EEOC allow testing for COVID-19 as a part of the pre-hire screening program?
Yes, it does. Actually, the EEOC guidance speaks specifically to that point, to say that, just as a return to work situation could pose a direct threat to the workplace, so is a new hire. So essentially, the EEOC has said that an employer may require a test for a new hire in order for that new hire to enter the workplace. And again, that's a distinction, not a teleworker, not work from home, but if there is a workplace component, then and the direct threat is triggered, then yes. You may want to consider like what happens if that person is positive, because it may be a situation where you want to delay the start date. These are things that the EEOC has stressed that right now employers are encouraged to be creative, to be flexible, and to not just to exclude someone, even though you are within your rights to say you can't come to work now until you have a negative test, but to be patient and work with that person and consider delaying their start date if possible. It's not, and again, if you have an immediate need and you're an essential service, you don't have to wait, but the EEOC has mentioned all of this in their guidance. And then the other thing that comes up periodically is, what if an employee doesn't want to get tested or doesn't want to come back to work?
I think we're going to see that a lot. Yeah,
and that's a situation where if an employee refuses, what do you do? And again, this is where the EEOC says, okay, well, you may exclude them from the workplace if that's really a requirement of their job. But if they have a pre-existing condition or some other medical condition or disability that needs to be taken into account, it may trigger reasonable accommodation under the ADA. So you really have to think about, okay, ask the employee why they don't want to have this test or why they don't want to come back to the workplace. And you have to dig down and ask those questions to find out why, and if there is a reasonable accommodation for that person, that might be something that's required. If a person does say that they have a pre-existing medical condition under the ADA, you can require proof. Again, it's similar to just as you would any other situation, but but you may have to accommodate things like a serious heart condition or chronic respiratory disease with COVID, if that's, going through your ADA analysis.
So we just got
that too. I just want to mention because it's come up, and I'm just triggered. Like I'm thinking of things that have come up in conversations with clients, with family members.
Right.
You don't have to accommodate a family member's condition. So that is something that we get asked about. Like, what if somebody in my family has a condition, and can I say that I'm a risk to my family member? And the law doesn't work that way. It doesn't extend to that.
So you said that the point that you just brought up, which I think is a great one, because it's something I've actually been seeing out like online as well, like seeing that question in regards to family members, people who live in your household, things like that. What else are you hearing from our clients, or the questions that we've been helping them with to answer?
Well, one question is, can you single out a particular employee? Like if, or do you have to have the same program for every single person in the workplace? And there, again, the EEOC has addressed this in one of their webinars to say that, you can actually, if someone's exhibiting symptoms at the workplace, like coughing or showing a known symptom, you can single them out to say, look, you're showing a symptom, you better go get a test.
Right.
And require that to allow them to stay at the workplace. Or you can follow up with the questionnaire, or require them to do daily temperature checks or whatever. So that is one thing that you, again, this direct threat sort of analysis applies where if someone is exhibiting a symptom. But if it's not a known symptom, you can't single them out. And again, it's something where you really have to, if somebody's just sort of distracted or not doing their job well or something, that's not a symptom of COVID. And then, again, about family, I think that one of the things that people ask, wonder is like, can you ask if a family member has contracted the disease or the virus, or can you ask about a family member? And the EEOC has said that the better approach is just to ask whether or not you've been in contact with someone who has tested positive for the virus or shown symptoms of the virus. And the reason for that is the GINA laws, which are the Genetic Information Non-Discrimination Act. GINA prohibits you from asking about the health of family members. So you really just sort of have to ask it in a more general way.
Right. So aside from anti-discrimination and the GINA law you just spoke about, are there any other legal considerations employers need to look into?
There are. I think it's beyond the scope of our conversation today. But there are different laws that may be invoked, and because, for example, the Fair Credit Reporting Act, FCRA implications, if you're using information to potentially determine whether or not someone is hired, or whether or not someone can start a job. There are questions around whether or not that particular fact-specific use of information could be implicating the Fair Credit Reporting Act. Also, where you're getting your test, if you're going directly to a lab versus CRA and Sterling, and companies that are CRAs, they have different systems built around helping employers navigate that particular use case where it is being used in a workplace environment, and ways that you can help enable your compliance and track all that information. So we're happy to answer more questions about that directly after our session today, and certainly any other questions that come up around the EEOC and really any regulatory issues around the return to work COVID testing issue.
Yeah, so we did get an interesting question on Facebook because we do know that a lot of stuff, is adapting, is changing, with the virus, but then also with the guidance from the EEOC. So how much time or notice will lawmakers give employers as the rules and understandings of COVID change?
Well, thus far, we really haven't seen, the law, those that enforce the laws,
Right.
the EEOC, the FTC, the CFPB, have not really changed any enforcement policies. There have been a few things where the different regulators have said, we'll take some things into consideration, but the law is the law. And what the EEOC has been very clear about is, yes, we're giving you guidance, but you still have to follow the ADA, and we're not going to, let you off the hook. It's all compatible with what the existing law says. You still need to take into consideration, for example, pregnancy. You can't treat a pregnant person differently because you think that they might have an issue with COVID. It could be sex discrimination, that kind of thing. So the law is the law, and while we may see things come out in litigation, I think we will see litigation in the future, but right now, as far as lawmakers, other than some relief that Congress has been looking at, when it comes to things like anti-discrimination laws, they're not really making exceptions.
Right. So I'm going to take a minute here and open it up to our audience to ask us questions for Angela as we do wrap up today's show. But in the meantime, we did just get another one in, and I do think it's interesting. So can COVID-19 testing be done through automation processes so employers can get correct results with no manual intervention? So I think that's more of a broad question of how these, health testing is going to work. But to spin it from more of like a compliance standpoint, is there any guidance on how these tests are done, whether they are automated or manual? Does it matter?
I don't know about an automated test. These tests require physical, lab samples taken, and as far as any decisioning, the employer still has to have their own policy in place and determine how they're going to treat the results. And there are all sorts of flavor. It really depends on what your particular use case is as an organization. There's no completely touch-free, this is all, someone has to actually, if you're going to use the information for a direct threat premise of a safe workplace, there has to be some review or determination and decision about that by the employer. And some employers are doing a variety of things. The test is not the only determining factor. So you can be negative, but if you have a questionnaire and that person is still exposed to someone at home who is active with the virus, then that could be a reason to say don't come to work this week. So it's really fact specific, and there may be a number of considerations. It also may be something that the employers want to just make available to the employee, for the employee to know and review, and the employer isn't using it at all. So again, very fact specific, and we're seeing all iterations of it.
Got it. Thank you. So as I take a second here too, and still asking the audience to ask us questions, in the meantime, Angela, do you have any final thoughts? Anything else that you want to cover?
I guess I would just encourage organizations to really take to heart the EEOC's sort of, broad statement that this is a time to be creative, be patient, really think about how this is affecting your workforce, and the organizations that we've worked with are very thoughtful. They're being very, considering the long-term effects of this on their workforce, and those that are just getting people back into the office that have been out since March. This is a big step. For those that have been doing some iteration of this all along, they're looking for a way to do it better.
Right.
Be creative, be considerate, look at your policies, make sure that you have the right safeguards in place. Any test information or medical testing of COVID, including temperature taking, is a medical record. It needs to be confidential. It needs to be handled properly. So all of that whole wrapper still needs to be in place. Right. And that's really, really important for employers to think about and understand, and work with your resources, work with your outside counsel, get good legal advice on this, and work with partners that you trust.
Great. Well, I am going to go ahead and we're going to end this right now. But thank you so much. This was a great conversation. We got a lot of great questions live during the show. So as always, our audience, you are always allowed to ask questions throughout. So as we do end today's show, you can always stay ahead of the ever-changing regulations and timely updates from our compliance experts. So you can do this by visiting sterlingcheck.com and going to the resources section. And there'll be a compliance update area in our resources section on the website. So thank you so much for everyone joining us, and special thank you to Angela for being our guest today.
Thanks, Caitlin. Thanks, everyone. Stay safe out there.
Yes, stay safe. And we will see you all next week, Tuesday at 1 p.m. Eastern. So thank you again, everyone.